So, in today's conversation, we will explore what it means to build a purpose driven public health career.
Fast forward, now we understand how important the environment is and where people live and what they have access to their health. So now that health equity is well known in our field, it's also been controversial in the past year, right? If you want to study infectious diseases across the world and you go to a school that is hyper local in their focus, right? That's just not a good fit. So you need to know those issues.
What really makes a PhD application stand out?
At the PhD level, you should have a good idea of what you want to study and who you want to study with. So I always tell the students there's advantages and disadvantages no matter which way you do it. Right?
Good morning, everyone, and welcome to another episode of the Scholars Table. On this podcast, we sit with scholars, leaders, and practitioners to have honest conversations about academia, leadership, graduate education, and work behind meaningful public health careers. I'm Dr. Banda Khalifa. Today, we are honored to be joined by Professor Tiffany Gary-Webb. She's a professor in the Department of Epidemiology and the Associate Dean for Diversity, Equity, and Inclusion at the University of Pittsburgh School of Public Health. She also serves as Associate Director of the Center for Health Equity and has held faculty positions at leading schools of public health, including Columbia University and the Johns Hopkins University Bloomberg School of Public Health. For more than 2 decades, she has focused on the social and environmental determinants of diabetes and other chronic diseases and interventions to improve outcomes for minority populations and translating those research findings into practice. So in today's conversation, we will explore what it means to build a purpose-driven public health career, one that is scientifically rigorous, grounded in equity, and connected to real-world communities. We will also discuss the PhD journey, how students can prepare strong applications, identify mentors, build research experience, and enter graduate school with both clarity and purpose. Professor Gary-Webb, it's an honor to have you on the Scholars Table.
Good morning. It's an honor to be here.
So I usually like to start off with a bit of intro for those who are listening to you for the first time. I've had the opportunity to even meet you in person, Hopkins, but for those who are watching this for the first time, could you walk us through your academic journey, a little bit about what drew you to public health, epidemiology, and hopefully health equity?
Okay, sure. So my public health journey starts decades ago in undergrad studying biology before there was a lot of opportunity for public health at the undergraduate level. And so I was studying biology on my way to medical school and then did a visit to a medical school in Philadelphia as part of a program to expose underrepresented students to medicine and realized very quickly that medicine wasn't going to be for me after I visited the cadaver lab. So that was one thing that happened. The other thing that happened is in my junior or senior year, I took statistics. And unlike a lot of the other sciences, which I could do, statistics really clicked for me because it put the numbers in context. The numbers had meaning. And so at that point, I got exposed to epidemiology. And so I enrolled right after I graduated at Hopkins in epidemiology in an MHS there and stayed for a PhD. So that's part of my journey is that I went straight through the academic journey while I was young. So did my bachelor's, my MHS, and my PhD all at the same time. I graduated, I was 26 years old. So, yes, so that was wonderful in the sense that life didn't get a chance to get in the way, right?
Yeah.
So before marriage, before children, before full-time jobs, all of that. So that's the advantage. But the disadvantage was I was young and I could have benefited from some work experience and would have brought that to the PhD, right? And it would have made my PhD experience a little richer. So I always tell the students, there's advantages and disadvantages no matter which way you do it.
Yeah.
Right? So the grass isn't greener on either side. Yes.
Okay. All right. And reading your work, it seems like most or much of your work focuses on social and environmental determinants for chronic
Yeah.
diseases, especially diabetes, obesity, and the rest. So I think this is a domain that a lot of people have a lot of misconception about. But from your career, what do you wish more people understood about the connection between the social conditions and health outcomes? Because most often
Yeah.
people see these chronic diseases and suddenly make outrageous conclusions about individual choices. But what do you understand, or what do you wish people understood that connection between social conditions and health outcomes?
Sure. So I'll start from the public health perspective. So back when I was training, we didn't have the concept of social determinants of health yet, right?
Mm-hmm.
And so when I started working with my mentors, Fred Brancotti was my mentor in the Welch Center. He had a big diabetes group and he had a study in African Americans in East Baltimore looking at nursing and community health worker interventions to improve care for that population. And so I got involved with that work. It became very clear to me that a lot of the reasons why the participants couldn't control diabetes or were being going in the hospital and so forth were based on other factors. It wasn't based on the clinical factors and access to care to a certain extent. It wasn't based on their behaviors and what they were and weren't doing, but a lot of it was the social determinants of health. Access to resources, first to healthcare, to transportation, it was food availability in neighborhoods, it was all those types of things. But at that time, we weren't naming them, right? And so I knew from the perspective of the community health workers who were going into homes what some of the challenges were. And we were intervening on those challenges at that point in time. And so in the epidemiologic cohorts, there wasn't a lot of emphasis on what are the socioeconomic variables and other variables that are determining outcomes. So that's why I didn't do my work in the traditional epi space at that time. But fast forward, now we understand how important the environment is and where people live and what they have access to their health. And so fast forward, now social determinants of health is well known not only in our field, but it's in people outside of the field. People understand it better. I can't tell you back when I was teaching in cardiovascular epidemiology, when I would say something like racism is associated with cardiovascular disease and the looks that I would get in the 90s about that, right? Because the whole concept of there's structural determinants like racism and so forth and policies. There are social determinants like access to resources that all influence your behaviors, which then influence your health outcomes. So we're not quite there, even with our field. Our field, I think there's a sector of the field that really understands, right? But we've come a long, long way in the past couple of decades with the field understanding. Now I think it is a matter of getting clinicians and getting more community residents, other people understanding that the small amount of time that people spend in the healthcare setting is not the major influence on their health outcomes.
Yeah. I think health equity has become a phrase that we hear often in public health. From your perspective, what does health equity really looks like when we want to move from just the slogans to something that becomes real practice?
Yes.
How would you define health equity?
So this is another term that wasn't, when I was training, wasn't really around, right? So we talked about the disparities. We talked about the differences in populations, but we didn't talk about the fairness and the fact that different populations need different type of interventions. And that's really what health equity represents. So back when we were doing social determinants of work with Black populations and with diabetes in East Baltimore, we were also doing health equity work because we were assessing where the participants were with their needs, and then we were intervening on those needs but we weren't giving everybody the same thing, right? Because not everybody needed transportation, or not everybody needed help with medication, or help with interpreting, or health literacy with the doctors, right? So we really took the patient where they were and gave them the things that they need. And so that's health equity. So now that health equity is well known in our field, it's also been controversial in the past year, right? But the one thing I do want to say is that it took us a long time to be able to name these things, right? And so health equity, social determinants, racism as a public health issue, those type of things, those took a lot of science, a lot of work, a lot of advocacy. So we don't want to just, based on the times that we're in, just say, oh, we're not going to use those terms, because there was intentionality about those terms. So we have to find ways to keep the work going and to keep naming the work.
I think you've built an exceptional career across research, teaching, leadership, and service. For early career professionals like myself and others, how should they think about building a public health career that is both rigorous and purpose-driven?
Yeah. And so this is a very, very important point, because what I had decided early on is that the work that I do would make a difference at that time in communities. Now it's expanded more so into communities, to other countries, and so forth. And so that was a conscious decision I made, in that I would have to do things that would go along the career track, right? The academy has certain requirements. You have to publish, you have to get grant funding, you have to do certain things. What I did is, one, had parallel work, right? So I would have some work that was with other people, or some work that was strictly in the academy, some work that was in community. But then over time, those were able to kind of come together and cross. So if I was focusing on, for example, a community coalition to work on chronic disease prevention, we would do that work in community, but then we would also publish that work in the literature. So it's a balancing act to be able to do a lot of those things. And for you all as early career professionals, it's getting better, in the sense that there's more recognition that community engaged scholarship is a thing. There's more recognition of social determinants of health. And so now those metrics are going to be put into the promotion and tenure criteria, right, for many of the schools. That's one of the things that we're working on at Pitt, is to consider community engaged scholarship more holistically. So I'm hopeful that you all won't have to do so much of a dual life and a parallel life. You can kind of do the meaningful work, and that meaningful work can count for the academy, but also really make a difference in the world.
Most of my listeners are either early career professionals or prospective graduate school applicants, PhD, who are interested in public health, epidemiology, health equity, and the rest. So I want us to talk a little bit about the admission process and how to better position yourself for PhD programs. I mean, for someone who has gone through non-stop from bachelor's to PhD, and also has been with Hopkins and others, may have like a very good perspective. So what really makes a PhD application stand out? I always tell people it's not only the grades and the test scores, but what really makes maybe committees think that, okay, we think this applicant is a good.
Yeah, so it's been a while since I've been on an actual admission committee, but one thing that I'll say is that really understanding exactly, at the PhD level, you should have a good idea of what you want to study and who you want to study with. So at the master's level, you're still exploring, you're learning. You could switch your topics, you could switch focus areas, disciplines, those types of things. But at the PhD level, because it is intensive study in a certain area, you really should have a good idea what you want, because so much of it is the match to the school that you're going to. If you want to study infectious diseases across the world and you go to a school that is hyper local in their focus, right? That's just not a good fit. So you need to know those issues. If you don't have a faculty member in that department that does what you do, then a lot of times the schools won't even accept you. It's not even based on your qualifications or so forth. It's based on who is actually going to mentor you. So I think really understanding what you want to do. And it's also nice too to have connections. Yeah. So, and this is where working in the field is also a nice way to boost it, because you have connections, you have people who know your work, who can vouch for you, right? Because those recommendation letters, you can tell who really knows the candidate and who is just looking at a resume and responding. So I think there's a lot of things. It is a difficult time right now, but we know how necessary our field is. We're seeing it in real time, right? Yes. Even though we're seeing changes in our science, changes in our policies, those types of things. At the same time, then we're seeing reversal of those things. Then we're seeing outbreaks that need to be addressed. Our relevance, it's going to be there. And this is a moment in time where things are chaotic, but we have to stay the course, because the world and the public, they need us. They need us to continue to keep everyone healthy. They need us to do the science to move things forward. We don't want our medical and scientific advancements to stop, right? So once we get through some of the chaos, we will come back to really do the work that we need to do. So stay the course.
Yeah, we are hopeful that things get better. And I think you did mention for applicants, identifying a potential faculty, it's very important. But what should students look for when identifying a potential faculty mentor? Hopefully, like just beyond the surface research interest, what other things do you think they should be looking out for when reaching out to potential faculty?
Yeah, it's hard if you're applying to places where you don't know the institutions, but it's also nice to be able to see what their teams are like. For me, doing the visits after acceptance and doing the visits, that's when I actually met my mentor. And that's when he exposed me to the studies that he was doing and the team that he had. And I was just lucky that I was able to make that match early, because then we had a big team where everybody focused on diabetes as an outcome, but we all had a different focus. I had a social epi focus. Some had an endocrine focus, a primary care, a genetic. And so we all worked together really well. So I think in this age of team science, having someone who works as a team, has good collaborators, that's really important in this day and age, because the days of investigators doing big studies and they're the primary, those days are going behind us. We really have to have someone who's collaborative. And that's been, I'll have to say, out of all the things over the career, it's the collaborative spirit that has been the thing that has kept me going from the time I was in grad school with those teams, the wonderful teams that I've been able to work with over the years, now the international teams. I take it for granted sometimes how our field and our discipline works together and we work collectively, because it's not like that a lot of places, right? So for me, the evidence that there's collaboration and collegiality and those types of things should be a really important thing to look for.
Okay. But for the specific group of students who may come from, say, underrepresented communities, or first generation, or even international students who sometimes wonder whether they belong in the academic space, what advice can you offer to those students so that they don't have that mindset of thinking that they don't belong in institutions like Pittsburgh or say Hopkins or big institutions?
Yeah, and so I think again the support systems help with that. When you get in finding the support systems, because I definitely felt that way as a young Black woman coming into Hopkins. You have people from all over the world. You have people who have been valedictorian of their college class. And you have royalty from other countries, right? It was intimidating, and it did take me a little while to be able to get used to that setting. But again, it was finding those network of people that you could really relate to, people you could study with. And then I quickly realized that so much of it is based on opportunity, right?
Mm-hmm.
It's not
Yeah.
what you have, particularly if you're coming from other countries and the things that you've had to overcome, what you have as far as grit and resilience and even brilliance to be able to make yourself stand out for a lot of other people. You're just as good as anybody
Yeah.
who had the opportunity and came in and had everything that they needed to be successful, right? So the mentality has to change, but then you have to come in and make sure you have the support
Mm-hmm.
to be able to, when you have a problem, be able
Okay.
to reach out to people, right? Be able to talk about some of the issues that have happened. So I definitely understand that feeling coming in, but now being on the other end of it, I wish I had never had that feeling, right?
Yeah.
Now I walk in the room and I say, the ideas that I have,
Uh-huh.
sometimes they're so different. Why would I shrink, right? Just because society
Mm-hmm.
is doing that way. So again, that's also part of thinking about these structural determinants of health,
Yeah.
right? They or not or just structural determinants, period. They are the things that are keeping the brilliance from coming out of a lot of different settings,
Yeah.
right?
Mm-hmm.
So
Okay. Yeah, that's true. Our last segment is a little bit more fun. I ask you short questions and then you give me answers that are also short. So I've had some wild answers in this segment.
uh-oh.
So, so I mean, the first question is always goes back to I'm always looking out for books that I should be reading as an emerging public health
Mm,
professional. So
mhm.
if there's one book that you want every student, early career professional to read, how would that be?
Yeah, so we have been doing book clubs. So I work with a group of people focused on data justice, and we've been doing different book clubs. And so there's a lot of recommendations I have. But
Mm-hmm.
what I'll say is the last book that we read was Advancing Equity and Justice,
Mm-hmm.
that just came out last year. And it's a great summary of how, you asked me about health equity, a
Mm-hmm.
great summary of how that whole term, how the whole field evolved about,
Okay.
from a policy level, from research level, from practice level. It's a really good one. So that's one of my recent recommendations.
Okay. What skill do you think every PhD applicant should develop or student? Every PhD student should develop.
The first answer is the collaborative, but I'll say that just having the collaborative spirit, I think it's a skill. But I would say the self motivation, the self, because that's really what so much of the PhD is about,
Yeah.
being able to think of ideas, do things on your own, and it's not a structured type of thing, right? So
Yeah.
you have to have that self motivation and drive to be able to answer the questions and to be able to drive the research.
Okay. One mistake early career researchers should avoid.
Oh, wow. I'm trying to think one. No, I think maybe maybe focusing too much on other people's work. I think I've done that in the past. I mean, you want to get opportunities to be able to learn and so forth, but you can also get into a situation where you are doing the majority of
Of the work.
work for
Mm-hmm.
other investigators and people and not developing your own work. So
Yeah.
I think that's a fine balance, right? Because
Yeah.
you want to learn and you want mentorship, but then you also want to have time to do your own thing.
Yeah. Yeah. One habit that has helped you throughout your career.
I'd say, hmm, integrity.
Mm-hmm.
So if people had to describe some of the things I do, that's one of the things that they would say, because there's all kinds of opportunities to not walk in your truth. And there's a lot of risk sometimes in walking your truth. But for me, being honest, having integrity, that's kind of the principle that I stand on. And it's a lot of the principles that I really like my colleagues and collaborators to have as well.
Awesome. And the last one is coffee, tea, or something stronger in the morning.
In the morning,
Yeah.
in the morning, definitely coffee.
Okay. So you're a
In the
coffee person.
afternoon, coffee.
Oh, okay.
Absolutely. And
I see.
that's one of the habits I got from my mentor. We would go at 3 o'clock, go to the daily grind and have coffee and meat. And so now, how many years later, I have afternoon coffee.
Oh, wow. Oh, so you have at least 2 cups a day? Most times. Oh, okay.
So these are things you pick up, daily habits of other people. So
That's true. That's certainly true. I mean, when I was in Ghana, coffee wasn't part of my schedule. 3, 4, 5 years at Hopkins. Now I have to drink at least 2 cups a day.
absolutely.
Yeah. Anyway, so yeah, thank you so much for joining us today. But before you go, last words to early career professionals, prospective applicants who want to enter the field of public health, especially now when things seem to be getting out of hand. People look everywhere
Yeah.
and rethink their decision of getting into public health space. But we are still hopeful. So, what's one your final words for early career professionals and prospective applicants?
Yeah, I'll go back to what I said, that we're in a moment, but we can't deny our worth and that we're needed, right? And so even if the systems are not supporting us the way that we need to right now, at some point people are going to realize that we have to, and it's not going to look like what we had before. It's not going to go back to the way things were, but they're going to realize our value and our contribution to everybody. This is not, we're not a discipline that is focused on just ourselves or a small number of people. We're focused on the health of the public. And so once there's recognition that we can't go on the way that we're going now, with outbreaks, with chronic diseases the way they are all over the world, we're going to have to get to, and there's going to have to be a reckoning with everything, and we're going to come back to the work that we're doing. So stay the course. Even if some of the PhD programs are limited now, that's right now. We will see change in the future. And then also for the people who are already in the field, right? Just think about other non-traditional careers right now.
Mm-hmm.
I have had to pivot in my
Yeah.
career many times, right? For family, for work reasons, I've had to pivot. This is a time where you may have to pivot for a minute, right?
Yeah.
And then eventually you can find a path for the work that you want to do.
Yeah.
So,
Yeah. I mean, that's such a practical advice for public health professionals, especially at this point in time. The ability to pivot is very important, so that
yeah.
when the dust settles, you can always come back to what you love doing. So thank you so much for gracing this episode. I'm hoping that listeners will enjoy our conversation very, very much. So, if this is your first time joining us, this was the Scholars Table with Professor Tiffany Gary-Webb, so professor at Pittsburgh School of Public Health. Until next time, bye bye.
Thank you.
For more thoughtful conversations on health, science, academia, career, and public life, follow the Scholars Table with Dr. Banda. Watch or listen on YouTube, Apple Podcasts, and Spotify. The conversation continues at the Scholars Table.